So I want to welcome everybody back. I do want to remind you of a few of our guidelines. One of them, of course, is that as we engage in this conversation, as we engage in this practice together, of course, we want to be aware of the language, the words that we're using. They have power. We want to make sure that we're using language that is inclusive, respectful, and welcoming to everybody that's in our learning community conversation. Our goal is to explore this material together. If Sarah doesn't necessarily agree with what Clive or Paulette or I or Vanessa is saying, that's perfectly okay. This learning environment is not necessarily about coming to agreement. It's more about collaborative exploration. So I just want to remind you of that. And the last one is that it can be beneficial for each of us as we engage in this conversation and practice to really speak from the I. I had this experience. This is the work that I've done. This is what I believe. This is the information that I have. So I just invite you to engage from that I perspective. I had asked people to think about and be prepared to discuss a particular point as a way of beginning our conversation. And I'm wondering if there's, Gloria, you're nodding your head. So I'm wondering if you'd be willing to unmute, nod your head, and I pay attention. So Gloria, if you recall, what was it that I asked people to think about or to focus on as a way of beginning our conversation?
I think you had requested that we watch the video again, the ineffective video, and said not to watch the effective dentist video.
That's right.
Yeah, and I did watch it again. And from the very beginning, I didn't like the proximity, like she was so close to the patient. Yeah, and even the way she took off her gloves, like my dentist doesn't do that. She was really, so from the very beginning, I felt a little bit uncomfortable with the interaction.
Okay, excellent. Gloria, thank you. And Gloria is making a critical point that we always want to consider whether we're practicing motivational interviewing or some other style of counseling is what is the nonverbal communicating? Why are we choosing the proximity that we're choosing in regard to the conversation with the person? And Gloria, thank you for making an I statement of that. As you observe that made you uncomfortable. Fantastic, fantastic. Any other thoughts or any other reflections? Because I asked you to really think about, and I can't remember if it was Clive who pointed this out or if it was somebody else. It might have been you, Clive, but it could have been somebody else too, that the conversation between them did not start off on a bad foot. But at a certain point, there was a real turn. And I'm wondering, did anybody notice that or any thoughts? And again, Gloria, you're making a great point. The proximity alone maybe started it off, not as collaboratively as it could have. Go ahead, Paulette. What's your thought?
So I think the approach was wrong. And when it changed, when the conversation changed from just, it was because she was forcing the situation, forcing her viewpoints and not understanding and hearing or listening. So back to your point of language matters, the language was off.
Fantastic. And again, Paulette, you're identifying several things: forcing, lack of listening, pushing her point of view.
And the language.
And the language, the words, the actual word choice that she's using. Mm-hmm. Super. Mm-hmm. Thank you so much. Go ahead, Clive. Floor is yours, please.
Hi, good morning, all.
Morning.
I'm a firm believer that it's not always what you say, how you say it. It's how the recipient receives it. So if your presentation is off, I mean, it's over within seconds. You know, they're closed with any sort of criticism. So presentation is everything, regardless of, I guess, the verity of it is how you present yourself and how you relate. What
Mhm.
that's my belief.
Thank you, Clive. Thank you so much. And, I want to underline something that Clive said, because we're talking about motivational interviewing. We're talking about an evidence-based practice where a lot of the focus often in MI is on the core skills: open-ended questions, affirmations, reflections, and summaries. And Clive's point is really, really a critical point to consider. You may offer a reflection, and it may be technically an accurate, well-crafted, well-thought-out reflection. But how you offer that reflection is going to have everything to do with whether it builds that collaborative partnership. And again, we have Paulette and Vanessa to thank for that, because they pointed that out so strongly in our earlier conversation. So how we say things does really matter, especially when we're building a collaborative partnership with somebody. So Clive's point is a really critical point to consider. Technically, you may ask a very effective open-ended question, but how you ask that question, what is the impact of that? Is it building collaborative partnership, or is it establishing a power differential between the two? Okay, so Clive's point is really a very critical point. Sylvia writes, the dentist's facial expressions were horrid! Exclamation point. He was making ugly faces at the lady. Talk about nonverbal. Go ahead, Sylvia, please.
It was horrible. You're using tobacco products? Oh my God. Yeah, blah, blah. It was horrible. I was like, why is she making ugly faces at the lady? And again, that's when the lady started crossing her arms and backing up and being defensive. It was horrible. That combined with how she was talking to the lady was horrible. Absolutely.
Absolutely. And the language she was using. Sylvia, could I ask you a quick follow-up question?
I guess.
Sylvia knows me, so she knew I was going to ask her a follow-up question. So she was very enthusiastic about it, as you could tell. So that was irony, folks. Okay. So Sylvia, your point is really well taken and very well observed. My question to you is the faces that she was making, what did they communicate to you?
You're wrong. You're doing bad. You're horrible. It's not good what you're doing. Make a change and listen to me. Don't you know you're treating yourself poorly? It's horrible. Absolutely horrible. Yeah.
All of that, folks, communicated with just your face. Just your face. Wow. Very, very well observed. And thank you for indulging me in asking, allowing me to ask you that question. Yeah, and Allison agrees, very judgmental facial expression. So judgment. Tanisha agrees, the dentist was focused on being right and not making sure the patient felt heard. Okay. And Lena said that, and Bruce says, I want to make sure that we read this out, Bruce. Dentist could have used empathy when the client was expressing they're just cute little cigars. It seems like the convo changed when she was explaining to the client that Swisher Sweets cause cancer and other health implications. Yes, absolutely. And facial expressions do say a lot non-verbally. In fact, I would go so far as to say that they say everything. And I'll tell you something, folks, and Sylvia and Tanisha mentioning the facial expressions and Vanessa mentioning it, the fact that you will remember when our learning community conversation and practice is over, you're going to remember much more about what I did with my face than what I said. There's actually data that Vanessa finds that hilarious. There's actually data that shows that you're going to remember that more. So if I can communicate the content through my facial expressions, I'm going to be more effective at what I'm doing. Yeah, exactly. Oh, yeah. Thomas writes, the dentist did a great job of showing us how not to do MI. Thomas, thank you very much for saying that. And Vanessa is noting too, the dentist was very controlling and used fear tactics. Clive says 93% of communication is nonverbal. Wow. Wow, wow, wow. So I'm going to show you, and it's funny because Gloria, you actually started us off on that point about nonverbal communication and how proximity communicates something. So what I'm going to show, we're going to look at just the first few moments of that video again together, but I really want you to be thinking about it from the lens of nonverbal communication. And again, a lot of folks have focused on proximity, facial expressions, and I'd also like you to think about it from the perspective that Paulette brought up, language, the words she's using, and what Clive said about how she's communicating these words. And again, we're watching for the moment that a conversation that had potential to be a collaborative partnership, what the worker did that made that not possible. Okay, so we'll just watch the video together, just the first part of it, the first few minutes. The whole video is only 6 minutes, but we'll watch just the first few minutes together, but with those specific parameters in mind. And then we can spend just a little bit more time talking about that.
Okay, so I finished the exam. Have some good news and I have some not so good news. Looks like you don't have any cavities, so that's the good news.
That's great.
However, I'm pretty concerned about something I'm noticing in your mouth. Actually, if you look up here, the roof of your mouth, I'm noticing a lot of irritation that's really consistent with tobacco use. And you had said on your form that you're not a tobacco user, so I'm just wondering what's going on.
I don't smoke cigarettes.
Okay. Well, as I said, there's a lot of irritation. In particular, like I was mentioning, up here in the roof of your mouth, it's turned really deathly white colored and there's little red spots. And you probably didn't notice because we don't spend a lot of time looking at the roof of our mouth. But you're really damaging this tissue in your mouth, which can really cause some severe problems in terms of your oral health. It's called nicotinic stomatitis. And this is something we don't see in any patients who don't use tobacco. So maybe you're not smoking cigarettes. Are you smoking a pipe or cigars, or is there something else that could be contributing to this? Because I don't know what else might be causing it.
Well, the only thing, I've never smoked cigarettes ever. But when I go out with my friends, we like to go to, we like to go out to lounges and sometimes there are those nice young men that gift you different sorts of things. And we got some of those mini cigars, Swisher Sweets. They come in peach and grape, and that's the only time that really I've ever really used anything that's got tobacco in it.
Okay, so I think that's a pretty common misconception because they're fruit flavored. People think they're okay. Those are really bad for you. Did you know that?
Really bad, but they're just cute little girly cigars.
Right. They're still cigars and they're still tobacco. And so they still cause lung cancer, oral cancer, emphysema, all those same kinds of things that you would see with cigarettes.
Well, I only
really
use
important.
them just to relax.
So folks, any thoughts about why I'm stopping the video at that particular moment? And I'll let you unmute to comment on that. The patient, yes, the patient crossed her arms. Absolutely. Go ahead, Paulette.
So I think there was an opportunity right at the beginning when she said, this is caused by cigarette smoking. And she says, I don't smoke cigarettes. And she should have said, okay, So let's talk about it. Maybe she didn't, the dentist did not expand. That was her opening, I feel, at that point.
Right.
Make some statements rather than just continuing on. The moment someone says, I don't smoke cigarettes, that's an opportunity to ask other questions or to engage the conversation. So that was the first thing I noticed right there.
Understood. And Paulette, I want to underline that because what you're acknowledging is a missed opportunity.
Absolutely.
Fantastic. Yeah, go ahead, Thomas, please.
And from my observation, and I think it appeared to me that she wasn't doing MI at a dentist, but she was being very professional. But the patient, it seemed like she took offense because she felt like she was probing a little too deep. And she was saying, like, you need to mind your business because this don't have anything to do with me coming in here for dentistry. So, I mean, and of course, I'm trying to learn MI. So I at that point, I hope I can get some insight into how maybe on the other end, the dentist should have proceeded.
Understood. Thank you. Thank you so much. And Thomas, you didn't use this phrase, but I'm going to use it and tell me if you think it speaks to what you're saying, is that it appeared that the dentist crossed some sort of boundary that made the patient uncomfortable and caused her to become defensive, which is her crossing her arms. I mean, Thomas, would you agree with that? That it was kind of like the dentist went too far in some way?
Yeah, I think she may have. She struck, yeah, I think she went too far. She struck a chord or something.
Yes.
I would agree. Mm-hmm.
Yes. Yeah. And it's interesting because, yeah, go ahead, Demetra. What were you going to add?
I was going to say, when she started with statements, no questions. And when she said, I have good news and bad news, she didn't even give the patient the opportunity to say, oh, can I hear the good news first? Like everything was just statement. Like you did this, you did, everything was accusatory from the time she started her discussing the results. It was just very accusatory, nothing welcoming, nothing to say. And she didn't even have to point out where it's coming from. She could have said, hey, I see some irritation. Is it bothering you? No, just it's this, and this, and this is what you're doing. Nothing, I know, patient, doctor, nothing, no dialogue, no true dialogue. You know what I mean?
I do.
I know what I'm doing.
Not this.
No, it was just, you did this, you did that. I wouldn't go to you either. You know what I mean? I don't want to hear anything more that you have to say. You're accusing me of something that just like, it's none of your business. Just, you see irritation. Is it irritating? You don't need to find out what, you already know what it is. So you don't have to tell them if they didn't want to reveal that those are the things that are happening. You know what I mean? It's just,
I do.
It's just,
I do. I get it. And I want to link what you're saying, Demetra, to what Thomas is saying, because we're in this conversation. Clive, Gloria, don't lose your points. Don't lose your thoughts. But I just want to connect what Demetra and Thomas are saying, because Thomas, you're raising a great point. It's sort of like, okay, well, we're in this class and this conversation about motivational interviewing. So what could the dentist have done differently to create a collaborative partnership and to have created dialogue, as opposed to, Demetra, what you're saying is she just came in with, you're this, you're this, you're this. And by the way, did I mention you're a liar because you didn't tell me you're using tobacco? So, I mean, I don't know about you. I don't feel comfortable being called a liar by a doctor or anybody, honestly, because I don't want to lie. Clive, thank you for your patience, and then we'll go to Gloria. Go ahead.
I feel that in different interactions, it's gonna structure of the interaction is going to be based around the experience of the interviewer. It's going to be based around the maturity of the interviewer and the interviewee. Because the lady was the patient was an older lady. She was close to the conversation. The dentist is she might be new in her practice, maybe she didn't have, as a term that was used in the last conversation, she didn't have the proper bedside manner. I've worked with people that are in prison alternative programs.
Yeah.
People with co-occurring disorders, people with substance use disorder, things of that nature. They're not open to a lot of criticism. And a lot of these men and women are stuck in their ways, and a lot of them, they feel that they have the level of understanding already. They're not willing to change. I mean, so that's why the motivational interviewing and trainings like this, and using proper, the proper diction, the proper, I don't want to say etiquette. Well, I mean, I guess it would be etiquette, ways to address the interviewee, to get them to open up and be able to, to get them to address the reason that brings them into our offices.
Absolutely. And Clive, what I think you're really additionally saying, and I'm going to just put it in an MI term, which is that you're really talking about how does the worker, the interviewer, engage the person so that they can be in a collaborative partnership. And this dentist threw engagement out the window in this conversation, and even had opportunities to, and I'm going to throw out this phrase for you to consider, which is called course correction. Because had that dentist paid attention to the fact that that woman crossed her arms, she could have course corrected and said, something, let me back up a little bit. And she didn't choose to do that. She chose to go forward with her agenda. And actually, she became more aggressive as it went forward. Gloria, thank you so much for your patience.
No problem. And going back to the collaborative partnership, I believe when she put her hands on her waist, I've always learned that that is a power move or a power pose. So at that very moment, she's saying, I have the power. So going back to the nonverbal.
Yes. And something, Gloria, I am not at all surprised, given where you started us off with this conversation. I am not at all surprised that you picked up on that physical gesture. Again, because yes, and it was very scolding, Rose, you're absolutely right. But in addition to what Gloria is mentioning, I saw it very differently because Gloria had kind of primed us to think of it that way. So when she put her hands on her hips like that, what that communicated to me is that the dentist was thinking, aha, I figured it out. You are smoking and you're smoking these cigars. And now I'm about to tell you that. And it's funny because she telegraphed that. It was shaming, I agree. She telegraphed that non-verbally by the power gesture that Gloria pointed out, which is that she put her hands on her hips. And you could almost see it. You could almost see the wheels turning in her head. And I'm guessing because I'm not a mind reader, but I felt like I could almost see the wheels turning in her head where she was like, aha, now I get it. This is it. And I need to tell her that she's doing this. So that's, I saw that I saw that hands on the hip gesture. Yeah, and Paulette notes that the dentist amplified her authority. And when we're in an MI collaborative partnership, folks, we're two people in a conversation, both of which who have power. And that's what we want to be focusing on in terms of that conversation. And Thomas, I promise you, to your question, this dentist actually gets some MI training and we revisit this conversation. And I promise you, we will do that at some point during our time together today.
Can I just say,
Please.
Okay, like when we doing MI and it's a partnership, two-way, we should never come across as we making someone feel belittled or shameful. Am I right?
You are right.
We need to be mindful of language. That's what we're talking about.
Yes, and tone.
And tone, okay.
all of that. Yeah. To Juana, did you want to say something?
Yes, I'm glad you said about the shaming and tone, because when I was looking at it, I felt that the dentist, when you meet a person, sometimes people do an assessment on that person. They see they are weaker, they don't have enough strength, maybe because the woman was older and humble and more meek. And she just took control, was condescending, spoke down to her. She just took control over it to manipulate the situation, that she felt that she could say what she wanted to say and how she said it without the person having any feedback.
Yes. Yes, which implies I'm going to tell you what to do, as opposed to let's have a conversation about what your thoughts about this are and what you may want to do.
Yes.
Yes. Yeah, and that's a very different approach. That is shaming. That is acting as an authority.
Mm-hmm.
And you know what? I respect the fact that she's a dentist. And you know what? It's the lady with the pearls mouth. And she's going to make whatever decision she's going to make going forward, regardless of what the dentist says, right?
Correct.
Yeah, thank you. Thanks for adding that. And Paulette also notes that took away authority from the patient. Yeah, she basically disrespected. Oh, you said autonomy, not authority. Yes, she basically did that. She undermined the patient's autonomy, because let's face it, folks, when it comes to behavior change, even if we're in a program where the consequence of them not following through on something is that they're terminated from the program. Yes, and that dignity is also important to note. Thank you for also mentioning that, Tanisha, because for that woman to feel like she had to defend herself is not helpful. But folks, regardless of, even if somebody is going to be terminated from a program for not changing or not following through, that's still there. They'll still make that decision. And ultimately, we want to help people to use their autonomy, even if we don't agree with what they choose. Even if that doesn't feel good to us, because it won't always feel good to us. I'll give a concrete example. You may remember the young gentleman that we talked about last time, who his goal was to cut down the amount of marijuana he was smoking. He didn't want to stop completely. He wanted to cut down. I talked about that example, yes? Does people remember that example from last time? Yeah? Okay. Okay, good. So he wanted to cut down. Now, in our heart of hearts, we may really care. We may really see some negative impacts that the use of marijuana is having on this person, but ultimately, he's going to decide. And we want to keep the door open so we can continue to have a conversation with him, as opposed to the possible outcome of this conversation is that this woman may not come back to have another conversation with this dentist. So she might just continue smoking cigarillos, even though they're just cute, fruit flavored, whatever. But she may continue to keep smoking them based on this conversation. And I want to go back, Paulette, I think you said this, and I think you even also put it in the chat, but I want to go back to this idea of missed opportunity. There's even, if you remember, and I know some of you got the opportunity to see the video again, you may remember there's a point in the conversation where the woman with the pearls, after she's been, verbally assaulted as much as she has, she says, well, maybe I could cut down. And the dentist says, well, that's a great start, but that's not good enough. That's yet another missed opportunity. Okay. And to Thomas's point earlier, this dentist gave us a great example of how what not practicing MI is. Hanali writes, that's when we ask if it's okay, we share some information. Hanali, would you be willing to say a little bit about that? Because what you're really talking about is an opportunity to let somebody exercise their autonomy. So would you elaborate on that?
Yeah, when she originally asked her if she was smoking and she said no, she just started steamrolling into her spiel. She didn't even give a moment to say, well, that may be the case that you're not smoking cigarettes, but do you mind if I share some information with you about smoking in general and what it is? And then let her take it in. Then it's non-judgmental, it's nothing, and then she could then say, oh, well, maybe I have some questions, not just, I'm going to ignore your statement that you're not doing it, and I'm just going to just start blabbing information at you and then call you a liar.
I'm going to educate you, tell you you're a liar, and tell you what to do.
Put you in your place. Yes.
And put you in your place because I want you to change.
Right.
Hanali, I want to thank you for sharing that, because there's a strategy. Thanks for letting me know, Vanessa. There's a strategy, folks, and Hanali is referring to this. It's called the elicit, provide, elicit, or ask, tell, ask strategy. And Hanali, you're giving a perfect moment in this scenario where that strategy could be employed. And the strategy is, hey, okay, you don't smoke cigarettes. I have some information on smoking in general. Would it be okay if I shared that with you? So that's the asking. Is it okay if I share this information with you? Lady with the pearl says, yeah, go ahead, share it. She shares the information, and then the second elicit is, what are your thoughts about that information? Any reaction to that information? i.e., what are your questions about that? What do you think about that? And keep in mind, folks, doing that is being in a collaborative partnership, because guess what? The lady with the pearls could say no. Hanali, I'll throw out another permutation of that, and I'd be very curious to know what your reaction is about this. So the woman says, oh, I never smoke any cigarettes. And before the dentist offers information, the dentist could say, well, I'm wondering if it would be okay if I ask you a question. So she could ask permission to ask a question. And let's say the woman says yes. She could say, well, okay, so you've made a decision not to smoke cigarettes. What do you know about the impacts of smoking in general? So she could ask her an open-ended question. What information do you have about smoking in general? Now, Hanali, if I were to ask you that question, if it would be okay, could I ask you that question? Would that be all right? So if I were to ask you that question, so Hanali, tell me a little bit about what you know about the overall impact of smoking.
Well, I've heard that it can cause some lung cancer.
Okay.
I didn't realize it had other issues. I'm just being the lady with the pearls.
Got it. And would it be fair to say that lady with the pearls might have known that smoking in general could cause lung cancer?
Right.
Is that a pretty fair assumption?
Right.
Yes.
Yeah. So why not give her the opportunity to contribute into the conversation as well? Right.
Well, it makes her partly informed instead of making her just completely this idiot that knows nothing.
Correct.
It's like, let's find out where you're at on it. Right. So you're meeting them where they are. So, okay, well, what do you know, instead of me just giving you all this information that maybe you already have and have ignored, or maybe you had no idea that it also affected your oral health. You only thought it damaged your lungs.
Right. Naomi, did you want to add something to that? Did you want to comment?
No, sir, I'm sorry. I was just agreeing with her, she didn't give
Yeah.
her a chance to talk
Yeah.
about it. And she was just so pushy.
Naomi, could I ask you a follow-up question in regard to that?
Yes, sir.
Why do you think she didn't give her a chance?
Okay. If maybe she was just looking out for the lady's health. And she just didn't, she's the type of person that's totally against cigarettes. And she maybe have a family history of cancer. So she don't want to hear that anybody's doing tobacco. It's bad for you, it's gonna kill you. And I'm not hearing nothing else.
Yep.
And if you don't change, you're gonna find yourself another doctor.
Got it. So you're making a really important point. It could just be her strong belief. It could be based on her family history. So it could be her counter-transference in regard to it. It could be all kinds of things. And again, look at the impact, right?
Right.
Because she was clearly, yes. And the idea that it's the writing reflex, or what's now referred to as the fixing reflex. Go ahead, Paulette. And then we'll go to Clive. Naomi, thank you so much.
Thank you.
Oh,
Yeah, thank you.
I think they're, as professionals, we are supposed to be trained a certain way, a certain side of, I think someone mentioned bedside manners, might have been Clyde, a certain amount of ethics. And clearly, she looked a bit younger. I don't want to put that out there. So, but she did look a bit younger. And also could just be, look, I'm the young expert on the job. You're the older lady. You don't know this. I'm telling you, this is how it's supposed to be, not listening, not understanding. So I think she lacked a lot of training. And that was really what I saw. A very passionate about her work, clearly knew her stuff, clearly, but delivery was off, tone was off, pitch was off, language was completely off. So I think she requires some training.
Yes. And she's going to get it. The training, that is.
Yep.
She's going to get some training. Yeah. Go ahead, Clive.
Hi. Countertransference is a word. It's a scenario that I was looking for.
Yeah.
Transference projection. I mean, some more background on the scenario would have helped. We don't know what brought. Maybe I missed it. We don't know what brought the lady with the pearls into that office. Did she have an issue going in there? And if she had an issue going in there, and then then the dentist offered her advice, and the lady wasn't receptive to it, that's a whole nother issue. Because if the lady went in there, I mean, it sounds like she has a major issue, lady that is. So I honestly, through it all, I'm still standing on the side of the doctor. Her presentation was a little off, but I didn't see it as abrasive as some other scenarios that I've seen in my day. There was an issue that needed to be addressed, and it sounded like it was something dire that really needed to be looked into on the part of the lady with the pearls.
Mm-hmm.
I'm standing behind the doctor. I've been addressed worse than that in my day, especially if I needed help with something. Well, outside of needing help with things, you know what I mean? Yes?
I do. And I can understand you're offering the perspective that the dentist is potentially motivated by her desire to provide effective care. And again, the thing I want us to be able to focus on is what is the outcome, at least what we've seen in the video. What is the outcome of this particular approach or stance, even if the dentist feels justified based on the severity of the condition or the situation? What is the outcome? And it prompts me to want to share a little statistic that I think, and you can't quote me hard and fast on this, but I think that this statistic appears in the 3rd edition of Bill Miller and Stephen Rolnick's book about motivational interviewing. I think that's where I saw it. And that is that about 20% of people will respond favorably to being told what to do by a provider. About 20% of people. Now, what I'm going to ask you to do before we go to Lena is I'm going to ask you to do the math there. If 20% of people will respond favorably to a provider telling them what to do, what percentage, and I know it's still morning, but I'm asking you to do math here, what percentage will not respond favorably to yes, Paulette, Lena, Sarah, you are correct. 80% will not, Rose, excellent, will not respond favorably. Thanks, Sylvia, will not respond favorably to being told what to do. Now, I want you to think about that. Do you have the luxury or the ability or the latitude to be ineffective with 80% of the people who sit down in front of you? Paulette is shaking her head no. I would venture to guess no business or no social service program could stay in existence if they could only serve 20% of the people that came to serve them, to see them. Yeah, we need the funding. Absolutely. Correct. Yeah, it's just not sustainable. So regardless of how acute the situation may be, regardless of how important it may be, what we're considering within our learning community conversation, and I really appreciate that Clive, you and maybe a few other people are also acknowledging the passion or the desire to help that the dentist may have. And again, I think we need to look at the whole thing, not just, one. It has multiple sides. It's not just one-sided. Lena, we'll go to you and then we'll go to Demetra.
If it's okay, I would like to just share a personal sort of experience that I have with something like this.
Please do. Please do.
I was having some health issues and I had gone to a clinic that I'd had a good experience at before. And this time was awful. Like, it was very much the way that this dentist was coming across, where they weren't really listening to me. They were sort of asserting their expertise and not hearing my concerns and my experiences. And long story short, I never went back. I found a different clinic, and that different clinic treated me with kindness. They heard what I had to say, and the result was the same, that both doctors were right in what was going on, but I was much more willing and walked away feeling a lot better when I was treated with respect, when my concerns were heard, even if the end result is the same. It's just the delivery is so important.
Mm-hmm. Thank you, Lena. And you're making such an important point that one situation you were so uncomfortable is not the right word, but it was so ineffective for you that you took the action to find another clinic because you knew what kind of care you needed, even though the information you were getting from both places was the same.
Right.
Yeah. Thank you. And I really appreciate Lena sharing that story. And not everybody has the capacity to advocate for themselves that way. And I'm so glad that Lena was able to get the care that she needed and was able to take the action to find another resource to get that care. It's not always the possibility for everybody. Is that fair to say, Lena?
Yeah, but that's also the concern, though, is if somebody doesn't have the bandwidth to find a different clinic or to advocate for themselves or whatever the case is, the result might be that they just never get care.
Right. Exactly. And this, in this scenario that we have before us, it's possible that the lady with the pearls may have the bandwidth or the resources to find other care, or it may mean that she's lost to care and that nicotinic stomatitis, after seeing the video 700 times, you learn how to pronounce that, takes hold and she doesn't get the care she needs. Demetra, your thought, and then we'll go to Clive. Oh, we can't hear you, Demetra.
So just saying that there's a temperament of a lot of people who provide services that are very just technical. Like there is no comforting or welcoming, that's just their temperament. They're still providing the service, they're giving you the information that you need, and just this is just how it is. And like that personal, I've had someone who's like, I've gone to a medical profession that made me cry, like literally in tears, but it was true. It was what they said was correct, because I'm just band-aiding it. It is technically, I could die from it, but I was in tears. But I took that into account. Like, what is the outcome that I want with my health? And health-wise, do I want to live? Well, yes. Did I continue to see the professional? Yes, I did. Okay. And then they were a little calmer, but I was like in tears for days. Like, how dare they say this to me? Like, that is so mean. But it was reality that sometimes, every once in a while we might need that type of person to wake us up. But it's not always welcoming. You know what I mean? That technical approach is not for everyone. It's just not necessary all the time, But there are a lot of people in this world who are just technical. Like, this is what I do, this is what you need, and you need to take care of it immediately. That's pretty much,
Yep. And again, we're talking about motivational interviewing, so we're talking about behavior change. Okay, which is a process. Yeah. Clive, the floor is yours.
Hi. So now, as a clinician, I would have to wonder what the next steps would be. Am I going to refer the individual to somebody else? Because if they're not receptive to my prompting, and I mean, far gone are the days of shock therapy and forcing people to get treatment. So if it's detrimental to the person's health, I mean, I'd have to give them a referral somewhere else, or that would be the only option. I'd have to look at the policy and procedure, especially if it's a necessity. The lady now, at what point is the lady going to be open to understanding that she needed some help? Like they say, you can lead the horse, but you can't make them drink. Now, if the person gets a second opinion, like the lady was mentioned a while ago, if they get a second opinion and they're still not understanding the information that's being relayed, that's on them. It's on them at that point, and I'm not sure exactly. Hopefully they'll realize. Back to the presentation, that's everything. But I don't think that lady would have been receptive to anything that doctor was saying. Overall, regardless.
Well, it's so interesting, Clive, because and we're going to hear from Paulette, but what you just said and what a few other people have said are kind of inspiring me to want to break out of the planned trajectory of what we were going to do next, because I'm tempted, and I'm not giving into this temptation quite yet, but I may after what Paulette says. But I'm very tempted to play the first 3 minutes of the effective dentist video for you, so you can see a stark difference between the first 3 minutes of the first video and the second video, the first 3 minutes of that video. And I want to hear what Paulette has to say, but I'm very tempted to want to share that with you, because there's a tremendously stark difference between the two that is very relevant to, of course, the practice of motivational interviewing. So Paulette, the floor is yours, and then we'll see where things go from there.
So I'm just gonna be real quick. So on the point of being very technical, I'm very technical, extremely technical, but we also reflect upon the things we do, the patients, the clients we interact with over the course of a day, week, and maybe in a quiet moment to say, you know what, maybe I made some missteps here along the way. what would I do? I would think about it, call the lady back, apologize, say, look, maybe I did some things wrong. Give me a second opportunity, come back in, and then apply my technicalities, but also my motivational interviewing skills, and see if we could bring it back around, bring it back on track. So I just wanted to say that. So it doesn't matter how technical you can be, we still have those trainings inside of us. So we've got to come back with our reflection and say, look, you know what? I made a mistake. Maybe I need to call her back. Maybe I need to soften up my tone a bit, and then see if we can make it work. That was my 2 cents.
Thank you. And I'm going to go so far as to say that that was probably 25 cents because, and I'll tell you why. Paulette is touching on two very important elements. Element number one, and this is directly related to the practice of motivational interviewing. The way you learn how to do motivational interviewing, folks, is you do it and then you reflect on what you've done. And you ask yourself, okay, could that have gone differently? And what might I do differently? And part of the way you do that, and I'll give a very concrete example. Let's say I had the great opportunity to be working with Naomi. And let's say Naomi was having a conversation with a client about a particular behavior change, and she made an audio recording of that conversation, because that's the gold standard in providing supervision around motivational interviewing. So Naomi has an informed written consent. She records that conversation, and I listen to it as somebody who knows motivational interviewing. I would listen to that conversation using a validated screening instrument, and I would be able to point out the strengths that Naomi is bringing to that conversation. I would be able to point out the tools that Naomi was using. I would be able to offer, if there were any, some growth opportunities that Naomi could consider in regard to developing her MI practice. Okay? So MI really does require a certain amount of reflection on what you're doing. The other thing, Paulette, that you said, and thank you, your check is in the mail. It'll probably be about 25 cents, but it's in the mail. Paulette is also talking about what we can do in this idea of course correction. And I have a little gesture that I want to show everybody. I'm going to demonstrate it for you, but then I want you to do it with me, as long as it's not going to harm you or anybody else in your area. So this is the gesture, like this. So course correction. Yes, excellent. So let's all do it together. Course correction. Yes. Perfect. Wonderful. Fantastic. So, and hopefully everybody feels, yeah, you can stop doing it now. Excellent. That's good. You only have to do it once. So course correction. Anytime in a conversation, if we're attending to the feedback we're getting from the person, because it's a collaborative partnership, we can course correct. You don't have to do the gesture, but you can do something different. And Paulette, what you suggested, that dentist, even during that conversation, could have said, you know something, wait a minute. I'm doing an awful lot of talking here. Let me stop for a minute and let's back up. And that's course correction. And because you course correct doesn't mean you've done something wrong. It simply means that you're being attentive in the moment to what's going on and you're addressing it. Unfortunately, again, because it's an example that was created to teach us about motivational interviewing. Yes, Paulette, in tune with what's occurring. Attuned to it. Yes, absolutely. That this dentist just kept going forward. So Paulette has inspired me. I am going to show you, and we're going to stop, but then we'll see the whole video. But we're going to look at the first 3 or 4 minutes of the effective dentist video. And remember, we've watched the first video, now we've watched the first few minutes twice, and you maybe have seen it 3 times because you watched it on your own. Okay, but now we're going to look at the dentist practicing motivational interviewing. Okay, now let me say something about that. It's not perfect. Nobody practices motivational interviewing perfectly. But what it is hopefully it's a good demonstration of a collaborative partnership conversation. But remember, we're just going to look at the first few minutes because we want to see the difference between the two. We'll come back to it, time permitting. We'll come back to it. We'll watch the whole thing because I want you to see the whole thing. But at this moment, we're going to watch just the first few minutes. Okay? All right. So let me get that video for us. I have it handy.
Okay, hard part's over. So the good news is no cavities.
Oh, hooray.
Yes, always happy to hear that. I do have some concerns though, because I'm seeing some irritation in your mouth and the palate that's called nicotinic stomatitis.
Oh, that sounds bad.
Yeah, it is. It's some damage to the roof of your mouth that happens from tobacco smoking. And so I'm wondering if you can tell me a little bit about how tobacco fits in your life right now.
Tobacco? Man, I don't smoke cigarettes. I've never smoked cigarettes. I do go out with my friends. We go out to bars and, we'll have a few drinks and smoke some of those little cigarillo type things. I mean, I don't even think of them as cigars, and they're certainly not cigarettes. And I mean, I'll have 1 or 2 of those in an evening with my friends, but certainly not 20 or 30 of them a day like you would with cigarettes. And that's the only thing that could possibly have anything to do with tobacco.
So you've made a decision in your life not to smoke cigarettes. It's something you didn't want to do. It sounds like you're kind of concerned about the health effects of cigarettes, but you have been smoking the little cigarillos at least 1 or 2 every time you go out.
Right, but that's just like a social thing. That's something that my friends and I do. We it's not a habit or something that I have to have. And, talking about 1 or 2 when we go out for an evening, not packs of them.
Yeah.
Thoughts? Did it go by too fast?
That was so much better than the first one.
Okay, Naomi, what was, then we're going to go to Bruce, and then we'll go to Clive. Naomi, what did you think? What was so much better about it?
She was open to hear the lady's opinion. She didn't throw her opinion around, and I just think she was considerate of her feelings, the lady's feelings, by not being judgmental.
Okay. So she was considerate of her feelings. She wasn't judgmental. She was open to what the lady had to say. Okay. Okay. Bruce, what were you going to say? I saw that you had unmuted as well. What were you going to add?
I like the general difference in tone she had. It was more like exploring with the client and like what that might be. I think that definitely had an impact on how the client was perceiving the conversation, And I think I like too how she, the dentist said, how can you tell me how tobacco is in your life or something like that? That opened it a question that way instead of like the previous video where it was kind of like pointing like, it was more like directed and aggressive in that way. So I don't know. I feel like it welcomed the client to for open discussion more to explore that.
Super. Thank you so much, Bruce. And Bruce has just identified a very specific, and Demetra, I'm thinking of you as I say this, because you mentioned technical elements and technical approaches. Bruce has just identified a very particular technical choice that the dentist made. He asked her an open-ended question. So tell me a little bit about how tobacco fits into your life right now. So Bruce, very, very well observed, and you're noting one of 3 very specific technical things that the dentist did. Clive, go ahead, floor's yours.
I'm looking at it at the perspective that the client had a little more control over what went on. The dentist, she reacted in both scenarios based on how the client was addressing her. The client was more open and more direct about what exactly was going on, so that the dentist didn't have to do as much digging. Now, I do a lot of reading, so I believe that it's better to be proactive than reactive. Dentist was reactive all the way through, but that shouldn't be the case. The dentist should not be reacting based on how the client addressed her or how forthcoming the client was. But the dentist may not have the dentist may not have training in that area. But it shouldn't be an area where the client where the dentist should react aggressively unless being addressed aggressively by the client. It would be on the part of the dentist to train himself and present herself a little differently now.
Absolutely. And I guess the thing that I want to underline, and by all means, Clive, please react to this if you have a reaction. The thing I really want to underline is that if you think that the patient responded differently in this second one, the thing I want you to consider is the reason she responded differently is because she was invited to participate with an open-ended question. And I'm going to name a second technical thing that the dentist did. And I'm going to frame it the same way I just framed that. If you think the patient responded differently in this second one, she responded differently because the dentist used a reflection to reflect back what the patient said to her, i.e., she communicated to the patient, I am listening to you, and I am trying to understand what you are telling me. So I just want to throw out that the patient is responding differently because the dentist is engaging her as a collaborative partner, and she's technically doing that through use of an open-ended question and through a reflection, as opposed to, we don't know what the dentist's agenda is yet. And what I would say, what we do know about the dentist's agenda is that she wants to find out more. And that's very different than the dentist in the first video, although it's the same dentist. So those are very specific technical things that this dentist in this second video is doing. Any other thoughts? Crystal mentioned she showed that she was listening by reiterating the conversation. And again, technically speaking, Demetra, technically speaking, that is an intentional use of a reflection. That's one of the core communication skills that we use in motivational interviewing. Allison, she affirmed the patient's decision to not smoke cigarettes and reflected what she said back to her. Absolutely. And Allison, that's, it makes me think, and I can't remember I think it was Paulette who said this earlier. If a patient says to you, I made a decision not to smoke cigarettes, that's something you want to affirm. Even if she is smoking cigarillos, you still want to affirm her choice to not smoke cigarettes if she says that that's a choice that she made. Okay? Any other thoughts or any other reactions to the difference between the two that you observed?
I want to add one thing too. I noticed.
Go ahead, Bruce. Yeah, go ahead.
This time around, it seemed like the dentist gave like more time to let the client respond. Maybe it's just in my mind, like it wasn't just like boom, 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 like the last one, when she asked that open-ended question too, and just kind of let it a moment to let it marinate and let the client, think about it and respond. But that might have just been my perspective.
Well, if it was just your perspective, it was also mine too, Bruce. So it was just you and I. who had that impression.
I appreciate that.
Yeah, and I want to underline, I really appreciate Bruce's observation, and it may have been just Bruce and I who observed that, but I want to underline Bruce's observation, because when our conversation has concluded and you go out into the world and practice motivational interviewing and hopefully reflect on what you do, one of the questions you can be asking yourself, and you can think of Bruce and I when you ask yourself this question, you can be asking yourself, who did most of the talking? Did I talk or did they talk? And if you find that you're doing most of the talking, chances are you're not practicing motivational interviewing. And it can be that simple. Now, of course, to be practicing motivational interviewing, there are other things you want to and need to be doing, but you can, as a point of reflection that Paulette asked us to consider earlier, that we reflect on our practice. One of the ways, and think of Bruce and I when you do it, just ask yourself after the conversation, who talked more? Did I do most of the talking? Did they do most of the talking? And P.S., you doing a reflection of what they said is you talking, but you're repeating what they said. So that's not you doing what the dentist did in the first video. Demetra, I saw that you were unmuted. What did you want to say?
I was just saying that her whole body language, she was more relaxed, inviting her in, creating a conversational atmosphere instead of that I'm telling you what's happening and you better listen. So it's more relaxed.
It was more this than this. Yes. And as I noted, I think I saw somebody put this in the chat, like she still needs to work on her facial expressions. Okay, we all have the face we have, right? It's not perfect. But the fact that she invited her to participate in the conversation, the fact that she listened to what she said and she was able to reflect it, there's still more. It's difficult to talk and listen at the same time. Clive, I would go so far out on a limb as also to say it's impossible to listen and talk at the same time. And I'm also going to go out on a limb, because Clive inspires me to do so. I'm also going to go out on a limb and I'm going to say it's impossible to be listening if you're thinking about what you're going to say. I'm going to repeat that because, and maybe Clive, you agree with me and maybe others agree with me. If you agree with this statement, type an A in the chat. If you disagree, type a D. But the statement is this. It is impossible to actually be listening to somebody if you're thinking about what you're going to say next. Yeah, Vanessa's shaking her head. Shannon's shaking her head. Okay, all right. So again, keeping in mind, folks, that when we're practicing motivational interviewing, we are trying to understand what this person is telling us. We're trying to understand where they're coming from. Okay? So just keeping that in mind. So I'm actually, believe it or not, at this moment, I'm actually going to share my slides with you just because I want to touch on a couple of points that will lead us to our next kind of practice opportunity. And then I have another little short video that I'd like to show to you. And then I'd like to show this entire video to you, which is only 8 minutes. Rose puts in the chat, in my opinion, I think the point should always be the person talking more. I agree. In any session, we should be listening, analyzing, and thinking what our best response should be. And you know, Rose, I would throw out for you and everyone else to consider, when practicing motivational interviewing, especially if you really do it and you practice it and you reflect on what you're doing and you get feedback, the more you focus on simply listening and understanding what the person is saying, the more effective you'll actually be at what you choose to do next. Because it will be based on a much deeper understand. Yes, intent. Yes, Hanali, absolutely. Intent to hear, not to respond. Because the key to effectiveness in motivational interviewing is doing our best to try and understand what the person is saying, and understand on the top level, the middle level, and a very deep level. Because they may be saying one thing, but actually communicating something else to us. So let's walk through just a couple of nuts and bolts kind of components of motivational interviewing. And then we'll move to, I think, our little short video or our little practice scenario. So I just wanted to touch on client-centered counseling because it was mentioned in our part one. So remember, folks, you can be practicing client-centered counseling and not be practicing motivational interviewing, but you can't be practicing motivational interviewing unless you are practicing client-centered counseling, because MI at its root foundation is client-centered. Client-centered counseling is different than motivational interviewing, because when we are practicing motivational interviewing, there's an identified behavioral change goal that we are exploring ambivalence about, and we are helping to decrease that ambivalence, and we are helping to strengthen that person's intrinsic motivation or motivations to change. And remember the young gentleman, his two intrinsic motivations were that he wanted to stay employed and that he wanted to maintain a positive relationship with his girlfriend. Those two things were why, in addition to some other things, why he was considering cutting down the amount of marijuana that he was smoking. Those were his intrinsic motivations. Motivational interviewing is also not the same thing as the stages of change model or the trans theoretical model. You can think of it this way, folks. The trans theoretical model, stages of change model, is a way to understand the overall process or journey that people go through as they change. Motivational interviewing is an evidence-based practice about how to have conversations about a specific change that someone feels ambivalent about, and to help them to increase their motivations to make that change. So again, they are two separate things. It's helpful to have an understanding of the stages of change or the trans theoretical model of change, and it is not motivational interviewing. If you were to pick, and I'm not going to ask you to do this, but if you were to pick one of these 9 basic reasons why somebody might want to change, the thing I'd imagine, if you were to pick one and to type that number in the chat, which I'm not going to ask you to do, but if you were to do that, I'm pretty confident that not everybody would pick the same number. And the reason for that, folks, is because people change for very unique reasons that are very personal to them. And when we practice motivational interviewing, our goal is to help identify what it is this person's desire to make this change, their ability to make this change, their reasons to make this change, or their need to make this change. And that's unique to every particular person that we may have the opportunity to have a conversation about a change that they're considering and that they're ambivalent about. Now I'm going to advance the slide, but then I'm going to stop sharing my screen for a moment to tell you a brief story. And some of you who've been in MI conversations with me in the past are probably very familiar with this story, but it's a very relevant story to our job when we're practicing motivational interviewing. So here's the story. I had the opportunity to be in a conversation with a woman who was considering cutting down the amount of cigarettes that she was smoking. She was actually smoking 2 packs of cigarettes a day, 40 cigarettes. She wanted to cut down from 2 packs a day, 40 cigarettes, to 15 cigarettes a day. And again, that's a harm reduction goal. That was her identified behavioral change goal. Okay? That was what she wanted to change. I want to go from 40 to 15. I was practicing motivational interviewing with her. So my goal was to help decrease her ambivalence, her desire to continue to smoke 40 cigarettes a day, and to help build her motivations, not mine, as to why she wanted to make this particular change. Now, I'm going to ask you to use the chat, and we have about 35 people, 34 people in the learning community. I'm going to ask you to use the chat to type in, what do you think her top motivation was to make this change, to cut down from 40, okay, health. Okay, so just type in the chat, what do you think? She was ready, excellent, okay. And I'm asking you to guess. Cost, health, lifestyle, cost. That's a 3 for health, wanted to feel better, cost, family, question mark. Yeah. Motivation for children, health, cost, health. Okay. All right. So I'm getting a general sense. Support system. She had a support system that could maybe help her. Yeah. Family input. Thanks, Thomas. So this is what she told me. Okay. Because I was in an MI conversation with her. She said to me that she and her 6-year-old daughter were watching TV together. And she was sitting on the love seat, and her 6-year-old daughter was sitting in a side chair. And they were watching a comedy program, and they were laughing and they were enjoying it. And then a commercial break came on. And guess what kind of commercial it was? It was a quit smoking commercial, or you're going to get the ends of your fingers cut off. You're going to have a tracheotomy, or you're going to have to drag an oxygen tank. The commercial happened. They never said a word to each other about it. The comedy show came back on and they were watching it. She said that at some point during the comedy show, she realized that her daughter, unbeknownst to her, had gotten up from the chair and walked over to her side. And she said her daughter took her hand and put it on her mother's hand. And she said, "Mommy, I don't want you to die." That is why this woman was considering making this change. That's more powerful than any education I could have provided her, any data that I could have shared with her, because that was her motivation. Now, remember, I was practicing motivational interviewing with her. So my question to you is, what do you think happened next? Because that's what she told me, and I'm practicing motivational interviewing. So what do you think happened next? And let's Vanessa, if you wouldn't mind, could I ask you what your thought is about what happened next? And then maybe we can hear from a couple of other people, but
it's very personal. It's very heart chilling. It's very chilling to me. Because I have a son who passed away 2016, and when I had smoked for 30 years. And when he was 6 years old and he was in elementary school, he brought home a book of headless matches. And he said, "Mommy, I want you to stop smoking." I was smoking at that point a pack of 100 Newport menthols every day. And I tried to quit, but I'm telling you, it was so bad. I would be crying. I was trying to quit so bad. And it was tough, but we don't really realize how other people around us feel, how they're affected, and so on and so forth. But that's why this was really touching to me, because it's very personal. It's been 31 years since I've had a cigarette now. And that's because of my son planting that seed with me. Yeah, thank you. Thank you for that share.
Oh, you're so welcome. You're so welcome. Thank you, Vanessa. And Vanessa, thank you for sharing such a personal story. Thank you. So I'm wondering, folks, I was practicing motivational interviewing with this person. What do you think happened next? And I see a couple of people are putting in things in the chat, but I'm going to invite someone to unmute. What do you think happened next? Go ahead, Demetra.
I just saying, okay, so how can I help you? What can I do to help you start? Because it's the question. You put it out there.
Yep.
Like, you're ready. So
Yep.
what can I do to help you get this thing started?
Got it. So what Demetra's suggesting, and thanks for starting us off, Demetra. You're suggesting that maybe I said to her, so how can I help you to get this started? So I would have asked an open-ended question. Hanali, I saw that you wrote something in the chat. Do you want to, what do you think I said, or what do you think I did next? Go ahead.
Well, how did your daughter's response make you feel?
Okay, which would have also been an open-ended question.
Yeah, because then that exposed, I mean, that was her, if that was her tipping point, is her daughter's action, well, then what was your reaction to that? How did that make you feel to make you start exploring that? Because that's going to get into her ambivalence about smoking.
Fantastic, fantastic. Hanali, before we go to Gloria, could I just ask you a quick follow-up question?
Sure.
As I told that story, how did it make you feel?
Oh, I got teary. I went back to thinking when I was a child and throwing my mom's cigarettes away, you know, those programs, and, you know, the trying to get them to like, this hurts everybody and I want what's best for you.
Right. So it really brought you back to that.
Yeah. Yeah.
Okay. Thank you. Yeah. Gloria, what do you think? What do you think I did? What do you think happened next?
Yeah, I think I put it in the chat. So maybe just validating, you know, what she stated, and then following up with what Hanali said. So validating her statement and then following up with how did that make you feel? Okay. Excellent. And Tawana, I saw that you had unmuted. Did you want to comment what you think happened next, or what happened next?
Actually, it was just something about from what Vanessa has shared, and thank you for being so transparent what you shared, because it reminded me when I was a child, because we used to have to always go to the store to buy cigarettes for my mother and father.
Yeah.
But my mother more so, and it was like maybe 3 to 4 packs a day for both of them.
Yep.
But my father slowed down, but my mother didn't. So me and my brother started taking her cigarettes, and I was like, "You smoking too much." And she was like, "Wow," she didn't realize how much she was smoking and how we was watching her. So it really made a difference.
Yeah.
And she wound up lowering her amount because she didn't know that the intake, and between the coffee and the cigarettes, it was just a regular norm. Waking up at 6 o'clock in the morning, having a cigarette and coffee because they would eat together, you know. But over time, she stopped.
Okay. Thank you so much. So folks, do you want to know what happened next? I can tell you because I was there and it actually was recorded. Kristen, do you want to know or should I just move on? Kristen's going to unmute and tell us. She's going to give me permission to either Chris Dahl is saying, did you cry? I wanted to, I'll tell you that much. Go ahead, Kristen.
Please tell us what you did.
All right. So here it goes, folks. Pay very close attention. Okay. Remember, I'm practicing motivational interviewing, right? I said nothing, and I stayed present for the moment. Because what she said was so powerful. I needed to give it the space to do its work. So I used silence and presence. And don't misunderstand that. Silence and presence is not nothing. It's powerful. And yes, Vanessa, it can be an aha moment. And then after that moment had had its power, and Crystal is asking, doesn't that make the person feel like you're not concerned? What I can tell, Paulette is shaking her head no, and Sylvia is shaking her head no. What I can tell you is that what I felt and what it seemed was going on in the moment, and I'm giving you my subjective perspective, but what it felt like was going on in the moment is that we were both in the moment together. She said what she said, and it needed the space for her to reflect on it, to take it in. Lena, you want to comment on that? Go ahead, please.
I've been in therapy for a long time, and this is something that I notice my therapist does all the time, is she'll sort of take a pause when I've said something. And to me, it just feels like what you were saying, giving me a second to sort of reflect on what I've said or arrive at a conclusion that it seems like I'm getting to, but maybe I just need another second. But I also understand how it could, sometimes it is a little awkward, and sometimes it does make me feel like, what do I do now? What do we do? But I think if the person in that situation has something to say, or you notice that the pause is maybe like a second too long, you can say something. But I do understand why it would maybe feel like, or why you as a clinician would be concerned that it might come across that you don't care.
Right. Understood. We'll go to Kristen and then we'll go to Demetra, because Demetra, I see. Thank you so much, Lena. Go ahead, Kristen.
As a counselor, I would be counseling people at times, and they would say something that just was very heavy, and it did, you gauge it in that moment that this just needs to sit for a minute, and it gives them a chance to process. It gives you a chance to process. And you can feel it in those moments when it's appropriate. It's more organic. But I've experienced that where somebody shared something with me and it was like, all right, we're going to just sit with this for a minute, and give them a chance and give me a chance to know when to move forward and how to move forward.
Absolutely. And I want to hold your thought for just 1 second, Demetra. I just want to acknowledge something that Vanessa put in the chat, which is that some people are uncomfortable with silence. And that's true. That's very true. And the thing I want us to consider connected to the practice of motivational interviewing is that sometimes we need to allow people their discomfort in order for them to decide what is next and right for them. Now, I could have attempted to help the moment be less uncomfortable for this woman, but would that have guided her toward her change? So we are not in MI, we're not trying to make people uncomfortable. But if part of the change process is uncomfortable, we want to respect people's process. That's part of their change process. So I'm sorry, Demetra, thanks so much for your patience. Thank you.
Oh, it's okay. I just wanted to say that giving that moment validates the power in the emotion, in the statement that was made. It provides the validation that it was just that it's powerful for me too. Like it's, it's keeping me from crying, but that's a powerful moment. That is significant, and you're providing that significance of what they said, that it is powerful, and just giving them that validate. Yeah, you're yes, it's powerful. It's emotional, and keeping you from crying, I guess, pretty much, it's powerful.
I was very moved. I'll put it to you that way. So wonderful things are coming in the chat, and Crystal mentioned out of this whole session, this is the wildest thing I've learned thus far. Well, hang on to your seat or fasten your seatbelt, Crystal, because it's about to get wilder. Because I'm going to then tell you what I said, because I did say something. So Vanessa's like, uh-oh, here it comes. So fasten your seatbelt, because here it comes. That moment had its, and remember, folks, I'm practicing motivational interviewing. Okay. So the woman said what she said. I let it have its moment. I let it have its space. And I'm thinking of Bruce and I'm thinking of Demetra as I'm about to tell you what I then said, because I used a technical tool. And hopefully I used it with compassion. But I used a very technical tool, and I did it intentionally because, folks, when we're practicing motivational interviewing, we are helping to build someone's motivations, strengthen them, and to decrease their ambivalence about making the change. So I could go on, but I can also tell you what I said to her at this particular point. So Naomi, should I just go forward with our content, or should I tell everybody what I said to the client?
I think you should tell them.
Okay.
I was there, so I think you should tell them. It's good.
All right. Okay, excellent. So I let the moment have its space. And then I said this. And I'm fascinated to hear your reactions to what I said. Okay, I really want you to tell me what your thoughts are about. I said, your daughter doesn't want you to die. That's all I said. So thoughts, reactions. Annalie, go ahead.
That is a hardcore reflection. That was the biggest feel that she had right there. She said it. My daughter put her hand on me and said she didn't want her to die, and that's the clincher right there. There's the reflection. Now let that sink in for a minute as well before we move forward.
Yeah, it's a reflection, folks. It's a reflection. And what she offered in that moment was change talk. That was her change talk. And I could have ignored that. And if I had, I would have been disrespecting the moment, and I would have been leaving money on the table, because that's potentially what will motivate her to change. And hopefully I did it. I made the reflection in a way that was compassionate. I can only report to you. I mean, you could, I don't have a copy of the audio recording, because by the way, the session was recorded. The session was being recorded because I was practicing motivational interviewing. So I share that with you because I want you to be very clear about how powerful the individual's motivation is, not why we think they should be motivated. And then I also want to demonstrate for you, I want you to understand, allow the space for their motivation to do its work, and then employ their motivation. And I employed her motivation by offering, and folks, technically speaking, Bruce, Demetra, technically speaking, that would have been coded as a simple reflection. It is making a transition when we use motivational interviewing because it's a different set of skills. Motivational interviewing is much more than just active listening. Motivational interviewing is selective and it's intentional. I intentionally reflected that woman's change talk. Vanessa, I saw your hand raised. Did you want to comment? Go ahead.
I'm just wondering if you can repeat what you had just said about authentic.
Yeah, I wanted to authentically reflect her motivation to want to make this change. And her motivation was because her 6-year-old daughter told her that she didn't want her to die.
Yeah.
That was her motivation. And you know, Vanessa, you prompt me to want to add something here. Sometimes we've been trained to think that the person has to want to change for themselves, that it should not be an extrinsic motivation, i.e. her daughter, her family, her probation officer. What I want to tell you is that in motivational interviewing, whatever it is that's actually motivating this person, whether it's extrinsic, intrinsic, intergalactic, whatever it is that's motivating this person, we want to reflect their change talk. Okay? We don't want to say to them, well, that's not good enough because you're not doing it for yourself. Because that would be our judgment. If the person is expressing this, is that this is their true motivation to want to make this change, we want to go with that. Yes. And Rick just wrote in the chat, desire, ability, reasons, need, and commitment is a different kind of change talk. But desire, ability, reason, and need are what are called preparatory change talk. The person's building their motivation. Commitment, activation, and taking steps, CATS, C-A-T-S, is what's called mobilizing change talk, where the person has actually made a commitment and we're not building motivation anymore. We're actually putting that motivation to work and the person is planning. But that's when the person says, I'm going to, I will. Or they come back to you and say, hey, this is what I could do to make this change. Or they come back to you and say, hey, this is what I did to make this change. That's taking steps. Okay? Excellent. So folks, I'm prompted at this particular moment. I have a very brief little video that I want to show you that's very relevant to what we just talked about, which is this. And I'm going to touch on this. I'm going to share two things and then we'll watch this little video. Somebody referred to this already. They talked about something called the writing reflex, which is now in the 4th edition of Bill Miller and Stephen Rolnick's book, being renamed the fixing reflex, which is that most helpers, most people who go into the helping professions have a desire when somebody sits across from them who is kind of on the fence about making a change, Most helpers will want to convince that person to change, give them information that will help them to change, all of those things. Acts is activation, Sarah. And acts is just another version of CATS, C-A-T-S. So the fixing reflex or the writing reflex is a normal response as a helper. And what motivational interviewing suggests is that we resist the fixing reflex. So when we have that desire to jump in and save the person, spare them, resolve it, give them the answer, that we hold back on that. And there's a little acronym that I'll share with you. You'll have it in the slides, but I'll share it with you now. It's called RULE, R-U-L-E. And the R, and don't worry, it's in the slides. You'll get it in the slides. But the R is resist the fixing reflex. Put your energy into understanding the person's motivation or motivations. Listen to what the person is saying. And empower the person. And empowerment in MI means allow the person to make their choice and to exercise their autonomy. Okay? Yeah, go ahead, Vanessa, please.
So one of the things that I do is I will ask a person when they come up with they're brainstorming, to come up with a something they can work with, or they think. Then they think about something like, and I will ask them, well, do you think you can do that? What do you think about that? Do you, to dig more? Do you think you can do that? Yeah. Like you said, to empower them.
Yes.
With the purpose of empowerment.
Sure.
The asking people instead of, like you said, trying to fix them. Yeah. Oh, that sounds great. Do you think you can do it? Then they'll reflect. Yeah. Well, what's your plan? How, can you develop a plan, like steps and so forth?
Yep.
Because it can be overwhelming.
Absolutely.
Like, this is the thought, but to solidify it by putting, like, what are the steps you can do? Where can you start? How can you start?
Yes. And Vanessa, you're talking about a very particular time in the MI conversation. And what you're specifically talking about is planning. And planning is the last part of the MI conversation. What comes before it, the 4 tasks that we focus on, the first one is engagement. How do we engage and create that collaborative partnership with the person? The second one is focusing. And focusing is where we find the behavioral change goal. What's the change you're considering? And then the third task, which is probably the one that people understand the least, is actually the practice of motivational interviewing, where we evoke that person's motivation. And I'll give a concrete example about that. The young gentleman who was considering cutting down, not quitting, cutting down the amount of marijuana that he was smoking. One of the ways that we could evoke change talk with this gentleman is we might say to him, although we know in the conversation already, 2 reasons why he's considering this change. But if we didn't know that, we could say, well, as you think about this change that you're considering, what are 3 of the best reasons to cut down the amount of marijuana that you're smoking? That's an open-ended question. That's intentionally used to evoke change talk. Now, what I can tell you is if that young gentleman answers that question and offers 3 very specific reasons that are his best reasons for cutting down smoking marijuana, we want to reflect them, i.e., repeat them, or we want to include them in a summary, which is repeating them, because that's how MI works. The person offers their change talk. We employ their change talk by repeating it, reflecting it, or summarizing it, or asking them to talk more about it, asking for elaboration. And then it gets repeated in a summary again. That's how the practice of MI works around a specific behavioral change goal. And I'm thinking of Demetra and Bruce as I say this, it's a technical process that we do in a very empathic way. But it's a technical process. So based on everything that we've talked about so far, I'm going to share this little video with you. It's very brief. It's from a popular movie that came out a number of years ago. The movie is called Inside Out. Some of you may be familiar with this movie, but I'm going to share a little scene from it. And then the question I'd like you to be thinking about is, how does this apply to motivational interviewing? Why the heck is Paul showing us this animated movie, and how does it relate to motivational interviewing? So that's the question that I'd like you to be able to answer. Okay, so now I'm going to get that little clip for you, which I have queued up here, and show it to you.
The stuffed animal Hall of Fame! My rocket! Wait, Riley and I were still using that rocket. It still has some song power left. Who's your friend who likes to play? No, you can't take my rocket to the top. Riley and I go to the moon. Riley can't be done with me.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
I had a whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster. Hey, Bing Bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took your rocket. They took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time, we had breakfast twice that day.
Sadness.
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on, the train station is this way.
How did you do that?
So, how does that little clip relate to motivational interviewing? Whoever would like to unmute and comment on that is more than welcome to. What do you think? How does that? Go ahead, Gloria, please.
Yeah, I think the first character was minimizing, what he was saying and wasn't really listening, and more focused on, coming up with solutions that are not congruent with the needs of the character. And the second character was really listening and reflecting and really hearing what he was actually expressing. Great movie, by the way.
Agreed. It is a really great movie. Yeah. Thank you, Gloria. Thanks. Any other thoughts, folks, about how that? Yeah, go ahead, Hanali.
Well, she empathized and validated with exactly how you feel right now, and tell me more about how you feel and your memories and why is that important to you. So it gave him the space to express that and then come full circle themselves with, now, okay, let's continue on.
Yeah, and he came full circle.
Yeah.
With that. Yeah. Thank you, Hanali. Absolutely. I see that some folks have put some things in the chat. So Rose is mentioning she showed compassion. Thomas says, got him to open up. The lady in the glasses. Crystal, trying to rush emotions instead of living them through. Yeah, absolutely. Shannon, sadness focused on him and his feelings, not fixing him. Yes. And Joy, the other character, really wanted to fix the situation so she could get her agenda, which was the train station. And Lisa says she allowed him to grieve. Yeah, and she offered him time. He had the time to sort of experience what he was experiencing. Super. So again, folks, when we're practicing motivational interviewing, we want to try and understand where the person is at that moment and where they're coming from as it relates to that behavioral change goal. Okay? Because the MI conversation is about a specific behavioral change goal. So to that end, let me share a couple of other things. Now, I'm going to share my screen with you to show you this slide, and then I have a little physical activity I'd like us to engage in, similar to the course correction. But you'll see here, MI equals times 4. And this is very relevant to that little clip that we just saw. That when we're practicing motivational interviewing, we want to try and be listening on 4 levels at the same time. Now, I'm going to stop sharing my screen for a minute because I'm going to ask everybody to point to your eyes. Go ahead and point to your eyes if you can. Point to your ears if you can. Excellent. Point to your ears. Touch your heart. And then touch your belly. Okay. And Kristen, if you wouldn't mind leading us in those 4 areas, that would be great. So you can start with your eyes, then move to the other 3 areas, and we'll follow Kristen's lead with the pointing. So go ahead, Kristen, you lead us if that's okay. And you can start with your eyes. Yep, eyes, perfect. Ears, super. Heart and belly. And the reason I'm asking you to do that, folks, and the reason I asked you to do it physically is because I really want you to remember this, is that our goal when we're practicing motivational interviewing is to be attuned, or to use Paulette's phrasing of it in the chat, tuned in on all 4 of those levels at the same time. Because those 4 levels, what we see, what we hear, what we feel in our heart, what we feel in our gut, are going to inform what we do and say next when we're in the MI conversation. And the thing that I really would like you to consider, and this is a distinction that I'm going to draw, that we could spend 6 hours just focusing on this, but we don't have 6 hours to focus on just this. Come back another time and we'll focus on just this. But I want to draw this distinction that there are many different kinds of reflections. And you may remember, I did that reflection with the woman who was considering cutting down the amount of cigarettes that she was smoking. And the reflection that I offered was, your daughter doesn't want you to die. And that was a simple reflection because that was simply repeating what the woman had told me. That's called a simple reflection. And I was able to pick that up with my ears. Okay? Yeah, go ahead, Vanessa.
I have a therapist that does motivational interviewing all the time.
Okay.
The part about it that drives me nuts, that I cannot stand, is what you were talking about, the summarizing and then repeating it again and all that. Like, I don't know, it just really bothers me.
Mm-hmm.
It just seems to me like she's not really listening and she's not really validating anything. she's just repeating back to me what I just said.
Yeah, and you know, let me underline that, because I know you started, what you just said was that she practices motivational interviewing all the time. I'm going to guess that maybe she's not practicing motivational interviewing all the time. And I'll tell you my hypothesis as to why. Because first and foremost, folks, keep in mind that motivational interviewing is not for every conversation. Motivational interviewing is for a conversation where there's an identified behavioral change goal that the person feels ambivalent about. That's motivational interviewing. Vanessa, what you're describing is you're describing a therapist who is using summaries and reflections as part of, quote unquote, the therapy, in terms of just communicating to you, I hear what you're saying. So that's different than when somebody's using that as a way to build somebody's motivation. So it's important, I think, to understand that just doing a reflection or doing an open-ended question doesn't mean you're practicing motivational interviewing. Those skills are not exclusive to the practice of MI. Go ahead, Vanessa.
So it's really frustrating. And she'll say, but then she just keeps doing it. So I just don't really want to go. I really don't, you know. And it's only because it's repetitive every single time. And I've been seeing her for like over 2 years.
Absolutely. And keep in mind that therapy is, and you have whatever goals, if someone's in therapy, they have whatever goals they have. And as a person who's receiving therapy, you're a customer. So you have the right to talk about, you know, how the conversation's going for you, what works for you in the conversation, what doesn't work for you in the conversation. And again, that's a whole other negotiation. But we're talking about the intentional use of these skills in the practice of motivational interviewing. When we're building someone's motivation, strengthening it, and we're helping to decrease their ambivalence. Lena, go ahead. And then I'm just going to say a little bit about the difference between a simple and a complex reflection. Go ahead, Lena.
I just want to speak to that for a second, because often when I have, let's say, friends or somebody that is asking me, how do I look for a therapist? I often say it's kind of like dating. Like, you have to find somebody that communicates the way that you communicate and that you can actually hear each other, and you shouldn't feel, you know, bad if you realize that somebody's not a good fit for you.
Right, right. Because as the customer, what you need is what needs to be prioritized. Yeah.
Right.
Yeah. So we talked about what you see, what you hear, the information you're getting from your heart and from your gut. Now, with a simple reflection, oftentimes that's just what you hear. Okay? With a complex reflection, which means there's added meaning. The complex reflection means that there's a hunch. You have a hunch about what the person is saying and what that means. And it's the continuation of their thought. And the thing I really want you to keep in mind, folks, is that reflections are statements. They end in a period. They're not questions. Questions end in a question mark. If I was to say to the young gentleman who's considering cutting down the amount of marijuana that he's smoking, if I was to say, you're considering cutting down the amount of marijuana that you're smoking because you want to stay employed and you want to make sure that your relationship with your girlfriend is good for both of you. That would be a summary. And that's a summary including that person's change talk. So a reflection is usually one thing, and a summary is a collection of reflections. And in MI, Bill Miller and Stephen Rolnick call that summary a bouquet. And they call it a bouquet because it's a bouquet of the change talk. We're handing the change talk back to the person. We're handing their change talk back to them so that it can strengthen their motivation to want to make this change. Okay? So the difference between simple and complex is simple is just what's on the top. And sometimes that's absolutely what's appropriate, and that's exactly what you need for that moment. And then sometimes there's complex. And complex is when you have a hunch that the person is saying more and you reflect that more to them. Okay? So keeping that in mind, and that's just two kinds of reflections. There are other kinds of reflections too. There's the double-sided reflection, which is joined by an and the change talk usually comes at the end. I'll give an example of that. You smoke marijuana on a daily basis because it's how you hang out with your buddies. And you're considering cutting down because you want to stay employed and you don't want to damage the relationship you have with your girlfriend. That would be a double-sided reflection. Okay, it's putting those two things next to each other with the change talk at the end. There's something called an amplified reflection. Amplified is, and I'll give an example that I'll draw from the video that we may get to see or you may have to watch on your own, the effective dentist video. And actually, you did see this moment where the dentist says, you made a decision that you weren't going to ever smoke cigarettes because they were bad for you. That's an amplified reflection. Okay, because we're making it bigger. So don't get caught up in the weeds with these. These are things that we practice and we reflect on and we learn about going forward. But the point I want you to keep in mind is that when we are tuning into somebody, thank you, Paulette. When we're tuning into somebody, we want to be operating eyes, ears, heart, and gut. There's information on all four of those levels that we're getting. And in MI, we can put that information to work as it relates to the change goal and the what we're doing at any given moment. Okay? All right. I'm going to share my slides for just a moment and remind you of a couple of things that we've discussed already. I shared with you about the fixing or the writing reflex, the fixing reflex, and I just wanted to visually remind you of this acronym that, again, we can resist the fixing reflex, we can put our energy into understanding the person's motivation, we can listen to what they're saying, and we can empower them by exercising their autonomy. We've touched on these three core components of motivational interviewing: MI spirit, and we're going to take a minute and focus on that. The four tasks: engagement, focusing, where we find the behavioral change goal; evoking, where we draw out change talk about the behavioral change goal; and then planning once there's enough motivation. We all know about open-ended questions, affirmations, reflections, and summaries. These are the core communication skills, and they're not exclusive to motivational interviewing. I want to take a moment just to touch on, and this is something we've been talking about since our first time together, but I want to name it so that you see it as a primary concept to the effectiveness of motivational interviewing. And I'm thinking of Thomas as I say this, because Thomas, you said earlier, and I thought you said it really well, when you said that first dentist video was an example of what not to do when we're practicing motivational interviewing. And that first conversation, there's no evidence of what's called MI spirit. And MI spirit simply means this is the way we want to be when we're in the conversation with the person. We want to be engaging in a collaborative partnership with them. We want to offer acceptance. And in MI, that means 4 very specific things. It means 1, that the person sitting across from us has absolute worth, no matter what they've done or no matter what they're doing. But just as a human being, they have worth and they have resources and probably have their own solution, or will choose what solution is right for them. So absolute worth. The next one is autonomy. This is all under acceptance. We want to honor and respect this person's autonomy to choose what they're going to do, what's right for them. The other one is we want to affirm their strengths and their efforts. And again, you'll see that these are 4 A's: absolute worth, autonomy, and affirmation. And then the 4th one is what's called accurate empathy, meaning we want to accurately and we want to empathize, but we want to try and understand very accurately what it is the person is feeling and expressing at that particular moment. And that's all under acceptance. And then compassion. We want to be interacting in a compassionate way with the person. And then the 4th one is empower. We want to empower that person, just like in rule, we want to empower that person to exercise their autonomy, to be able to choose what is going to be appropriate for them at this particular moment. Now, what I'd like everybody to do is type these 4 letters, one following the other, PACE, in the chat right now. And that's a way that you can remember MI spirit is PACE, PACE, partnership, acceptance, compassion, and empower. So 15 people out of the 35 or so, let's try and get everybody who's in the learning community to type PACE in the chat at this particular moment. PACE. Yes. P
I can't
for
get into the chat.
Okay, okay. All right, thank you for letting me know that. Excellent. You can in your mind, if you can't use the chat, in your mind, type out PACE. Excellent. PACE, partnership, acceptance, compassion, and empowerment. Again, we talked about these 4 tasks, and the one that I really, really want you to pay close attention to, because it's the heart and soul. In addition to MI spirit, this particular task is the heart and soul of the practice of motivational interviewing, which is evoking. We're evoking this person's motivations, their desire, their ability, their reasons, or their need to make this particular change. Without that, you're not practicing motivational interviewing. If you go from engaging to focusing where you find the behavioral change goal that the person is considering, and folks, thank you so much for typing PACE in the chat, and then you jump from focusing to planning, you're not practicing motivational interviewing. In fact, you're throwing out what motivational interviewing is, which is helping that person to explore their own ambivalence about the change goal and to identify and strengthen their own motivations to make the change. So if you're going to practice motivational interviewing, you do need to evoke. Excellent. And we've been talking about ORs basically from the beginning of this particular conversation. The open-ended questions end in a question mark. And keep in mind, folks, an open-ended question is a question that cannot be answered by yes or no. Crystal is asking, is ambivalence the same as motivation? It's interesting because ambivalence can include both why a person doesn't want to make a change and why a person does want to make a change. So ambivalence is a double-sided coin that can include motivation. Excellent, excellent question. And the other thing that I'll say about ambivalence, because ambivalence is not the same thing as resistance, I'm going to stop sharing my screen to say this because there's a visual. If you think about my hands, my two hands pressed together as two sides of a coin, and we say that this coin has two sides. You see the side that has the ring on it? That's one side. And see the side with no ring? That's the other side. This coin is ambivalence, okay? And it's the language of ambivalence. It's what the person says. So side number one with the ring on it, that's change talk. Same coin, other side, is sustain talk. Why the person wants to stay the same. They're the same coin, they just have two sides. In MI, we listen to both, we evoke change talk, the ring side, and we employ the change talk from the ring side. Okay? But it's the same coin, and it's the language of ambivalence. And remember, folks, it's not free-floating general ambivalence. It's ambivalence about a particular behavioral change goal. Okay? It's not general. It's ambivalence about a particular behavioral change goal. It's the language of ambivalence, both sides. Which prompts me to want to ask this, because I notice that we're rounding toward the final 30 minutes of our conversation in this learning community today. And my hope is that we'll have future opportunities to talk about motivational interviewing and to practice motivational interviewing going forward. But I'm prompted to want to ask a particular question at this point, which is this. Is there anyone within our learning community at this particular point who's personally, really, for real, personally considering any kind of behavioral change? And let me give a concrete example. A behavioral change you might be considering might be cutting down the amount of coffee you're consuming, or stopping drinking coffee altogether, or going to bed earlier, or exercising more regularly, or any of that. Is anyone considering a behavioral change at this particular point? Okay, so Crystal is saying that she's considering a new diet. Anybody else? So eating differently. Anybody else considering? Okay, Paulette, what if you don't? Would you feel comfortable saying what you're considering?
Yes, I'm considering dropping a lot of my biases.
Okay, so you're considering looking at your biases and then dropping.
Yeah, I've looked at them, so there's some that I need to work on.
Fantastic. Fantastic. And I see that some people are putting things in the chat. Tanisha says, I want to limit my screen time. Lisa says, retiring. Candace says, yes, stop drinking soda. Stacy says, reduce my sugar intake. Demetra says, yes, and secretly does not reveal what you're considering, Demetra, but that's entirely up to you. Lena says, better time management and knowing when to say no. I can rest adequately and perform better in my commitments. Darlene says, eating healthy. Rose says, yes, considering surgery for my eyes. Okay, pros more than cons. Rick says, fitness. Allison says, going to bed earlier. Okay, super. So the reason that I'm asking you that, folks, is that any of these behavioral change goals, you may feel ambivalent about them, and to want to just put eating better, exercise, time. Demetra says my hair. Okay, so and I'm not exactly sure what that means, Demetra, but again, any of these are behavioral change goals. Okay, and the time to go to the gym, Sylvia says. Okay, and Sylvia, I'm wondering, given that, would you be willing to engage in a conversation about that particular behavioral change goal that you're considering?
Yeah, I could use all the help I could get.
Okay. All right. Yeah. Now, just as a preface to this, folks, and Sylvia and I will just take a moment to engage in this conversation after Sylvia finishes her call. But what we will do is, the thing that I want you to understand is, and Clive writes, improve emotional health. Absolutely. And again, that could be connected to a specific behavior change. The thing I want you to understand is what Sylvia and I are going to demonstrate at this particular point is a real play. It's not a role play. We're having a real conversation, and Sylvia has generously agreed to engage in this conversation within the learning community. Sylvia is Sylvia, I'm Paul. We're just having a real conversation. And I am going to demonstrate the use of some of the skills with motivational interviewing, because there's an identified behavioral change goal. Okay? So I just want you to keep that in mind as we're having this conversation. And I want you to focus on, okay, so Demetra elaborates and says, taking better care of my hair due to the increased change of gray hair. Okay, again, and that could relate to a very specific behavior change. Super, thank you, Demetra. Thank you. So it's a real play, it's not a role play. And I want you to pay attention to the worker, which will be me. I'm just engaging in a conversation. Okay? And remember what we talked about. We talked about MI spirit. We talked about the 4 tasks. We talked about the use of ORs, open-ended questions, affirmations, reflections, and summaries. So all of that. So just keep that in mind. We'll do this for a little while, and then I'll pause it, and then we'll invite you to focus on what you observe. Okay? So what you observed in terms of motivational interviewing. So Sylvia, are you all set?
Yeah, I'm ready. Everybody wants to call me now. Yeah, I'm ready.
All right. So Sylvia, first, let me say thank you. And I always appreciate the opportunity to have a conversation with you. And if you would, just for the learning community, please confirm that we didn't speak before this, nor have I paid you to engage in this conversation.
How much you gonna pay me? No, yes, we did not prepare this, and he's not paying me yet. No, he's not paying me.
Okay. So Sylvia, if it's all right, could I ask you a question?
Absolutely.
Please say a little bit more about the behavioral change that you're considering.
I've been having difficulty getting to the gym like I used to at 4 o'clock in the morning. So I've tried lunchtime, I've tried evening time. I just wanted to be a little bit more consistent, but I'm a morning person.
So your goal is to consistently go to the gym, and having had an experience of doing that early in the morning, you're kind of now looking at what maybe change do you need to make, either in time or something else, in order for you to consistently get to the gym as much as you'd like to.
I want to be consistent in getting to the gym correctly, and I prefer morning.
Okay. So, and you're aware of that, because you are a morning person, your preference really would be to go in the morning.
That makes sense to me, yes.
All right. I'm wondering if it would be okay if I asked you a follow-up question in regard to that.
Yes, you may.
So if you think of going to the gym consistently, preferably in the morning, if you think about that on a scale of importance, 1 being not very important and 10 being extremely important, how important is it for you to achieve that goal for yourself?
10.
Okay, so it's of the highest on that scale, it's of the highest importance.
Yes.
Okay. In terms of your confidence, 1 being not very confident and 10 being extremely confident, how confident are you that you could actually go to the gym consistently, preferably in the morning?
7, 8.
Okay, so 7, 8. Why not a 6?
Why not a 6? Miss Marva, I'm sorry. Why not a 6?
Yeah.
Because I really want to do it. I really want to do it. I have the desire. I have the conviction to get out of my very warm, fluffy bed, and when the sun is not up yet, and get to the gym.
Okay. So your desire is there, and
Yes,
you're willing to sacrifice that warm bed in the dark to get yourself there, and because you're willing to make that sacrifice, your confidence is about a 7 or an 8.
And there are benefits. I did it before, and I felt good about myself.
Yes.
Afterwards, that's one goal I accomplished for the day. It's out before the day begins.
Yeah.
Gotten the gym in, and I can keep on moving.
Yeah. So in addition to the physical benefits that you feel, you also feel a sense of accomplishment. And because you've done it before, you know that good feeling, and you want that good feeling on both of those levels.
I do.
So Sylvia, what do you think would increase your confidence from, and let's say an 8, what do you think would increase your confidence from an 8 to maybe an 8.25 or an 8.5?
What would increase my confidence?
That you could accomplish this goal consistently.
I don't know. I don't know. I have no idea. No.
Yeah. So given your past experience, given the benefits emotionally, physically, and just accomplishment wise, you're pretty confident that you can do this, and you're not really seeing at this moment what would increase your confidence.
That's correct.
Okay. So on that same scale, but looking at your readiness to take some sort of action, meaning 1, you're not ready to take any kind of action at this particular point to achieve the goal, or 10, that you're ready to take some sort of action, where would you fall in terms of your readiness to take an action to consistently get to the gym in the morning?
Where am I in terms of readiness to consistently take an action? And that action means going. Does that action mean going?
Yeah. Or some other action. There could be something that would help you to go.
I'm 8, 9 ready. I'm 8, 9 ready. I got the gym stuff. I got the sneakers at the door. I got the sweats at the door. I got the little gym lock. I got my bottle of water. I got the phone with my earphones. They're all ready. Every night they're ready.
Okay, so you're ready to do this 8 or 9 because you've taken all these steps already by putting the equipment, the shoes, the water. It's right there.
Yes.
And it's ready for you to pick up and walk right out the door in the dark to the gym.
Yes, drive down the block.
Drive to the gym.
Yes.
Okay. What do you think would increase your readiness to maybe a 9.25 or a 9.5?
no, I'm stuck. That's where I'm stuck.
Uh-huh.
I am stuck. Everything is ready. It's prepared. I just don't get out the bed. I just don't. I wake up. God wakes me up every morning, says, okay, let's go. And I'm like, 5 more minutes, 5 more minutes.
Yeah. You've taken a lot of preparatory steps. God's even waking you up consistently every morning. And there's something at this moment that's keeping you in the bed and keeping you from picking up all that prepared equipment and putting your key in the ignition.
Yes.
If it's okay with you, can I summarize a little bit of what we've talked about?
Sure.
So the change that you'd like to accomplish is really getting back to something that you've already done and experienced a lot of benefits from. Physical benefits, emotional benefits, and also the satisfaction that, like, you've started your day, you've accomplished something, and you're moving forward. You're just going ahead. You've also prepared yourself to follow through on this because you're set up and ready to go every night. Your shoes are at the door, your water's at the door, your bag is at the door. You're ready, and God's even waking you up in the morning and saying, Sylvia, good morning, it's time to go. And what you're considering right now is what it is that's going to get you from the bed to picking up those things and putting your key in the ignition and driving to the gym.
Yes, I think this might help me because hopefully a couple of you guys will encourage me or check on me and say, Sylvia, how did it go? Did you get to the gym? We're cheering you on. We're rooting for you, Sylvia. Tell us you got there. I think I need outside. I have difficulty self-motivating. I need motivation from the outside. I don't want to start crying. Oh my God. Yeah.
Having someone that you could be accountable to.
Yes.
And also having people express their care for you. You know, Sylvia, I want to check in. Yeah, I want to check in with you because I want to know how you're succeeding on this.
Yes.
Having somebody that would ask you about that would help you because you need something from the outside. You've done everything on the inside that you can. That brings up a lot of feelings for you.
It's not fair, Paul. This is not fair.
You didn't realize how having that outside support, how important that was to you.
But I want to be able to do it for myself.
Mm-hmm. Yeah, because you know the benefits. And doing it for yourself would also involve you sharing it with others in terms of them checking in with you, in terms of you being able to report to them what you've accomplished.
Oh boy.
Would it be okay if I asked you one other question, Sylvia?
No, yes. Yes.
Which is it? No or yes?
Yes.
So Sylvia, you know, based on what we've talked about, what are your thoughts about what will come next for you?
I'm going to go to the gym.
Mm-hmm. Mm-hmm.
I'm going to go to the gym.
Okay.
I gotta go. I'm going to go to the gym.
Okay. And in terms of outside support or connection with people outside in regard to that, any thoughts about what's next for you?
I have difficulty asking for help. So, you know, it's a whole other issue for me.
Mm-hmm.
But letting people know I need help.
Mm-hmm.
And then letting them help me
Mm-hmm. Mm-hmm.
are different things for me.
Mm-hmm. Yeah.
So.
Yeah. It takes a lot of courage to admit that it's hard to ask for help. And it takes an equal amount of courage when you do ask for help to let people help you.
Yeah.
And that's what you're moving toward. Because it's a goal you want to achieve.
And this was supposed to be about the gym, not Sylvia's stuff. Oh man, yeah. But it's good. It's good.
Yeah.
I'm a little embarrassed, but yeah.
Because you're being vulnerable.
Yeah, absolutely. Absolutely. In real time. Absolutely.
Yeah. Well, we did say at the beginning, it's a real play, right?
Okay. Yes.
And I just want to say, Sylvia, that I'm really grateful that you volunteered, and I really do feel it's a privilege to have the opportunity to know you and to also have had the opportunity to talk with you about this.
Thank you. Thank you very much. Hopefully the next time I see you guys, I'll be like, I went, y'all. I'm doing it. I'm doing it. You know what I'm saying? Oh my goodness. Yeah. So.
Thank you very much.
Thank you. Thank you.
Thank you. Thank you.
Oh man. I'm turning off my mic so y'all don't hear me.
Okay. So, Tawana, I see that you have a question or a comment. So, but what I'm going to ask, because I want to be aware of our time and I want to make sure that you have time to complete the evaluation, I'm just going to ask everybody to think about for just a second. When you think about what I did as the worker, what's one thing that stands out to you based on everything that we talked about in terms of motivational interviewing? What's one thing that stands out to you in regard to that? And if you could, feel free to type that into the chat. I wish we had a lot of collaboration. Okay. I wish we had a lot more time that we could spend to kind of take this apart. But we don't, sadly. And again, I really want you to think about, I used reflection, I used open-ended questions, I asked permission, I maintained the focus on the behavioral change goal and everything that came up that was related to it. So again, I see that people are excellent. So well observed. Tawana, what was your question or the comment that you wanted to share? Because I saw that your hand was up before. So.
Well, I was going to share with her that, I'm there with you, Sylvia, because I have everything ready and sometimes needs encouragement. And I'd be the one to always reach out to people and give them encouragement. I just did it yesterday with one of my other girlfriends and to hold us accountable. And we can sit back in partnership, change numbers so we can sit up and call each other, say, you ready? Let's get it going.
Yeah, and you're offering support and you're also acknowledging that it's hard to ask for help.
Yes, especially when you're always the one to encourage others.
Yes, absolutely. Thank you. Thank you. So folks, just a couple of things I will throw out for you to consider before I show you the last slide. Rose is talking about sometimes engaging with a buddy who goes with you. And for some people that can be very effective for this particular behavior change. I hope the other thing you noticed in my conversation with Sylvia, and remember, that was a real play. That wasn't a role play. That was two real people talking to each other. I hope that you observed that I did not tell Sylvia what to do. Because in motivational interviewing, we don't tell people what to do. So just keeping that. Okay, good. Excellent. So just keeping that in mind. Yes, understood. So folks, We've touched on everything that I wanted to touch on in terms of the content, and much more, to be quite honest. And that's really a tribute to all of you in terms of your interest in what you brought to the table. I want to remind you that the slides that we're going to share with you are tools that you can use, that however they'll benefit you, feel free to use them in any way that supports what you're doing. I'm going to ask you to just take a moment and self-reflect. And just take a moment and reflect on your experience of our time together today. And there's no right or wrong. It's just your reflection of your experience of today. And I'm going to ask you to type in the chat, what's one thing that stands out to you about your experience of today? So just one thing that stands out to you about your experience of today. There's no right or wrong here. It's just one thing that stands out to you. And just go ahead and type that in the chat. There's no right or wrong with it. It's just a way for you to conclude and have kind of a final comment in this particular learning community conversation. My hope too is that you'll remember each other and you'll see each other in other learning community conversations with me, hopefully, because I welcome that, but when you're with each other in other settings as well. So just something that stands out to you about your experience in this learning community conversation. I'll just say before I show you the last slide, there's one other tool that I'm going to share with you. That is, there's a scenario that if we had time, I was going to share it with you. But again, our real play conversation was far richer than the scenario because it's a script. But I'm going to share it with you and throw it out to you to consider that as you look at this conversation between Conrad and the worker, it's a scenario between a guy named Conrad and the worker. As you look at that, I want you to focus on what is the worker saying and doing at any given moment. And that scenario is an am I conversation. So it can also be a guide as to how am I sounds when it's actually being played out. And of course, the other thing that you know that you can do is you can watch the full The Effective Dentist video, because that's another resource that you have available to you. The Effective Dentist video. Okay? Have a wonderful weekend, and thank you for being in this learning community and for everything that you brought to this conversation. Thank you so much, everybody. I hope that we'll get to see each other again going forward. Thank you.